afternoon, Angus. I'm your physiotherapist, Jessica, today. So today, you're here for your right side shoulder pain?
Yes.
So how many months have you had the shoulder pain?
Around 3 months.
3 months,
Yes.
okay. So what would you say is the main problem right now? Is it more stiffness or is it more pain?
About some little bit pain. Yeah, because
It's a bit pain, yeah.
go to gym. Yeah, and it started to pain.
And you said that you had problems lifting up your shoulder, right? And it's painful when you lift up the shoulder.
Yes.
So can you do this action and stop where you feel the pain and then tell me how much pain you have? Do you need my help or can you?
I can do it myself.
Okay.
If I go here, I
Yes.
will start feeling pain.
Okay.
And pain level will be
Alright, the
6.
pain level, we will raise it, okay? So 0 is no pain, 10 is the worst pain that you can imagine. So when you're up to about here, how much pain do you have?
About 4/10.
4/10, okay. So can I use you to help your arm? So when you lift up more, here I can feel some resistance. Is it very painful?
Yes.
Okay, so how painful is it here?
Around 7/10.
7/10, alright. So what we will do today, we're going to use a modality called Shortwave Diathermy. So this modality uses electromagnetic waves to help give some warm therapy and warm feeling to your shoulder. And what it will do, it will help to stimulate the tissue inside your shoulder to help soften the tissues a little bit so that when we're doing the stretching and mobilizing exercise, you will feel less pain and hopefully you'll be able to move your arm up a bit more each time. Are you okay to go ahead with this therapy?
Okay.
Okay, so let me just check that you're safe and also to make sure that you don't have any contraindications because there is a risk of having a heat burn if you don't have good sensations. So I will check if you have good sensations first. Is that okay for you?
Okay.
Alright, so just to make sure you're safe, do you have any electronic implant like pacemaker or a deep brain stimulator
No.
or the implanted hearing aid?
No.
Do you have any metal implant in your body?
No.
Okay, that's great. Do you have any metal on you right now?
No.
Such as your glasses, or like any rings, or a smartwatch, or any mobile phone?
Maybe a glass and a mobile phone.
Okay, so during the treatment, we will put those on the treatment bed over there, so they don't interfere with the radiation on the machine.
Okay.
Alright? Okay, because I don't want it to break, just in case. Do you have any other conditions, such as any malignancy,
No.
any tuberculosis,
No.
any active deep vein thrombosis?
No.
Okay. Do you have any, for example, skin conditions that could become worse with any heat? So heat-sensitive conditions?
No.
Okay, that sounds good. Do you have any, in that case, no infection as well? I'm going to check your shoulder and the skin around your shoulder to see if the skin is okay to you.
Okay.
Right? Alright. So Angus, I'm going to check your skin sensation now as well as your circulation. So we have a special hot and cold test to check your thermal receptors in your skin. So if you feel this one is warm and this one is cool.
Okay.
So I'm going to check the whole treatment area for you. You have to close your eyes and tell me what you feel.
Okay.
Alright? Let's start now.
Walk. Walk. Walk.
So your sensation seems okay. Can I just have a look at your hands? So I'm going to check your circulation. And your circulation looks okay too. Are you feeling a little bit cold? Oh, okay, great. Okay, so this is our machine. Let me just make sure that around your shoulder joint. ready to start. And before we start, I'm going to give you some instructions. Okay, so this treatment is going to last for 15 minutes. So during that time, try not to move. Because if you move, the distance between your skin and the electrode will change. And that will change the amount of heat that your joint is getting. So if you want to move, let me know. If you feel that you can't maintain the position, you're not comfortable, let me know. So also, try not to touch the cables in case of shock. And during the treatment, you should feel some mild warmth, but the warmth will build up. So if you feel nothing in the beginning, that's fine. It's very normal. Sounds okay?
Okay.
All right. If you notice that anywhere suddenly it's getting very hot, or there's one area that feels hotter than the other area, let me know, because this could be a hot spot, which can lead to a burn. All right?
Okay.
Okay. All right. So it takes some time to set up. Make sure you make use of all of the different joints in the machine, just to make sure that the electrodes are actually not touching the patient's skin, especially if they're breathing. So you check the breathing, that nothing is touching. And then use your hand to check if there's any warmth that you can feel. So you should feel warmth if the indicator here is red, because that indicates a thermal treatment. Okay, so how do you feel right now?
Feel nothing.
Feels nothing. Okay, this is normal. It takes a little bit of time for the machine to warm up more. So I will check you again in a few minutes. Alright, it's now 5 minutes into the treatment. How are you feeling over the shoulder? Do you feel any mild warmth?
Yes.
Alright, great. Do you have any particular area where you feel more warmth, or is it quite even?
It's quite even.
Perfect. Alright, let's continue. Okay, so let me just check. We're halfway through the treatment. I'm just going to check that the electrode is not touching you. Okay, that looks fine. Okay, a few more minutes, and then we can finish and do your other treatment for mobilizing your shoulder. Okay, so it's the end of your treatment now. So I'm going to turn off the machine and remove the electrodes from you, and then we will check how you feel.
Okay.
All right? Okay, so I'm having a look here. Okay, your skin feels a little bit warmer. So how about your pain right now, if you move up your arm to about mid-range? Oh, more range. Very nice. Do you feel pain? A little bit. So on the scale of 0 to 10, how much would you rate it when you're coming up?
It's now 2.
2. Okay, so that's improved. Let me help you a little bit as well. Just relax your arm. Relax your arm. Very good. How about now?
And I see that it's about 4 over 10.
Okay, that's perfect. So now's the right time for us to do the mobilization. So I'll let you put on your clothes again and connect your items, and then we'll go to that treatment area for some mobilization.
Okay.
All right, great.